The intake or assessment is the initial meeting with the client during which the case manager gathers information to address the client's immediate needs to encourage his or her engagement and retention in services. This process can also be used to screen clients to determine if they need case management services, and if so, to determine the model of case management most appropriate to meet the client's needs, and to assess the client's willingness and readiness to engage in case management services. The general purpose of the interview is to begin the assessment process. We want to establish some basic information about. We want to work from a strength-based approach, so we want to know what kind of external support systems they have, what are their talents, successes, and capabilities, coping strategies, and other aspects of resiliency in their personality. In addition to identifying the strengths, of course, we need to know what is going on with the client in terms of troubles or challenges. And so we want to identify weaknesses, maybe gaps in support systems, any type of lack of experience that they have or information that they need that could possibly make them more successful. And we want to understand the client's current level of functioning, how whatever problem or challenge that they're having is impacting their life currently. In addition to that, we want to understand the current problems that cause this individual to seek help right now. Why now is an important question to understand and gather some information about. We also want to understand if this client has experienced this problem in the past. This can help us identify if this is a recurrent problem or if the client maybe potentially already has some strategies or knowledge of how to deal with this problem if they've done so in the past successfully. We want to identify what potential problems are and just generally get a sense of who the person is, make them feel engaged and welcomed, and make them feel heard. There's some basic information that we need to gather in addition to kind of this general getting to know the person and their strengths and weaknesses, but we need to get some demographic information. We need to identify emergency contacts, go over confidentiality concerns. We need to understand the makeup of their household, insurance status, other current providers of social services or case management, or even health-related concerns that we should be knowledgeable of. Their basic contact information, identifying information, their name, address, phone number, date of birth, any type of special needs that we should be aware of. We also typically in this session do a basic assessment of needs that may include food or clothing, finances, housing, transportation, child services, legal services, substance use, mental health, domestic violence, and any other related concerns or needs. We also want to document any appropriate releases. If individuals are tied to other services, we want to make sure that we address that right away if they are willing to sign a release of information so that we can talk to other providers. And this is really important to have continuity of care so that everybody is on the same page, that we're able to share information, and we're able to really help this client from multiple points and providing the most holistic care possible. At this time, we also want to go over what type of services that we provide and go over any information that might be relevant to assess whether this client is appropriate for the program or if they meet the eligibility requirements. Finally, we should go over the policies and procedures, anything that's specific to your agency that the individual might need in order to make an informed decision about participating in your services. And at this point, we kind of want to talk about next steps too. We want to make sure that people leave knowing what's going to happen next, whether their case gets assessed or evaluated by a supervisor or a treatment team. But we need to let them know what that process looks like and what's going to happen next. Sometimes, if the client is being integrated into services right away, a treatment plan will need to be completed. Typically, an agency has a time limit on how soon that needs to happen after the intake interview and once the start of services happens. It's important that the case manager, who is in charge of doing an intake, is able to have good interviewing skills and put the client at ease. They need to be skillful in obtaining key personal information and recognizing potentially urgent situations. Placement into the appropriate case management model really depends on utilizing capable, empathetic staff. Information obtained during the assessment or intake should be shared after client consent with other providers to coordinate services and avoid duplication of efforts. It is important that if something comes up during the intake that is an urgent situation or a crisis situation, maybe pertaining to someone's basic needs, their housing situation, then the case manager needs to make sure that they know what action steps to take in order to address those concerns right away. Ultimately, the case manager needs to have some basic counseling skills. They need to be able to listen and understand, truly get a grasp on what the client's problem is and how your agency services might be beneficial to this client. As the case manager, we need to do some professional assessment to see if this person is eligible for our program and if they are appropriate for the setting. We also need to be really good at gathering information. A lot of times, agencies have a set framework for what type of intake they do, what kind of questions that they ask. And so you'll want to make sure that you follow that pretty closely. If your agency happens to not have some type of intake paperwork, it's probably best that you develop something to make your process a little more consistent from client to client. Finally, the intake acts as just an opportunity for us to build rapport, for us to get to know this client. Even if you serve as an intake case manager and you don't actually do anything except intakes, or you're only meeting people really for the first initial contact, you are the first person that this person has to base their experience on at your agency. So it's a really important part of the process that if we don't treat the client with respect up front during the intake when we're trying to gather all of this information and trying to get them engaged in our services, then we're going to lose them right away. And so anyone who acts as a case manager or intake case manager, it's really important that that first contact is a good one and it's a positive experience for the client. In most cases, clients understand that they need some type of help and often are seeking help on their own. But sometimes they don't feel like they need to be at your agency, or the court has mandated their participation in services. In situations like this, you may encounter some hostility or resistance from clients. It's important to not treat these clients any different than those who are really ready to seek help and who are invested in their treatment or services. In either case, you must indicate that you've heard all of their concerns and engage them in building rapport and having a positive contact regardless of what situation brings them to services. Your office is the place where someone will likely have the initial contact for the intake interview. So it's important that your office is set up in a way that is inviting and welcoming and conducive to having a professional contact. It is also important to consider how your office furniture is placed. We can never know or anticipate when or if a client might become violent. And so it's always important to keep our safety in mind when we're setting up our office, making sure that we have a direct line to the exit door. So your chair or wherever you are seated as the professional should be close to the exit, and it should be easily accessible in the case of an emergency. Another important consideration about the process of the intake is notes or not, or type on a computer, and sometimes note-taking can be seen as distractive or intrusive or as a negative experience for clients. However, during the intake, it's particularly important to get the correct information, and documenting it appropriately throughout the interview is important. So in this case, it would be really helpful to let the client know in advance that you'll be taking notes, whether it's on the computer typing or filled out on the assessment forms. But either way, it's important that you let the clients know that you'll be doing this, and it's not meant to be disrespectful, but just meant to be a way that you can get all of the accurate information. So as a case manager or intake case manager, your tasks are to make sure that you answer the client's any questions the client has about the process or about what the next steps are, and help them feel at ease with understanding what is going to be expected of them and making sure they have the right information about the services that you're providing. It's also important that you make sure that there is a mutual understanding of the problem and what's going to happen next. So whether that's summarizing and reflecting back what you've heard, making sure that they check and sign off on the information that you have noted or gathered from them. However you want to make sure that you are understanding the client correctly and have all of the accurate information documented. Finally, we need to make sure that the client has accurate expectations. So we don't want to make promises that we can't keep. We want to make sure that the client has a clear understanding of what they're getting into. This is all part of the informed consent procedures as well, that it outlines what happens in the treatment process, in the services that the client is receiving. And it outlines everything that the client needs to know. Everything from how often they need to attend services, to what the price is going to be, who their counselor is going to be, or what type of services they're going to get. So it outlines all of the details. So in an informed consent, we really should go over that both written and verbally with the client so that they have clear understanding and expectations about what to expect. At the end of the intake, we want to make sure that we summarize what we went over to verify that clear understanding of the problem, and we want to make sure that we walk the client out. This indicates that the session is over. If we get up and walk the client to the exit, sometimes it's important, if this is the first time the client's visiting your office, that they also just may not know where to go. And so we need to get the client back to a place where they feel comfortable and are able to get back to wherever they need to be, whether that's the waiting room or the parking area. And so we can't just leave clients, open the door and kind of kick them out when we're done. We have to make sure that we're really taking care of the client, making sure that they feel comfortable throughout the course of this process and even until this process is completely over. It's important to note that we should not allow people to leave the office if we believe that they are a significant danger to themselves or to others. That any time that there is homicidal or suicidal intent or ideation, that we conduct further assessment to make sure that that's something that we need to be concerned about, but not something that a client is going to act out. We'll talk about threat assessment at a later time. However, it's just important to note that if this comes up in the intake, that we need to take further steps to ensure that the client is safe before they leave, and making sure that they are leaving in a good place mentally.